Neonatal Respiratory Support Group, in partnership with Obijackson Women and Children's Hospital, Okija, recently organized a two-day respiratory support workshop with the theme Expanding the Reach of Respiratory Support Services and Products to the Southeast. The workshop, which was held at the conference hall of Obijackson Women and Children's Hospital, Okija, on the 23rd and 24th March 2022, brought together medical practitioners from within and outside the Southeast.
We are opportunity to have somebody that is actually well knowledge when it comes to neonatology, especially like the title of the program makes, helping baby to breathe. So we are opportunity to have Dr. Konkwo. And here in our center, whatever we are being taught here is what we've been practicing here, and it's actually giving us a good result.
I expect that those who have come for this training will hopefully go back and impact same, use what they've learned in our center to improve neonatal services in their own facilities.
The design of the hospital as it is now, the leadership aspires that this hospital will be a regional hub for everything neonatal in the Southeast. So this is part of one step of achieving that dream. After this step, we are looking at going to do trainings for so many other hospitals in this particular subsector of the health industry. So we are sure the participants will be exposed to our state-of-the-art equipment. We are also confident that it will help them spread the news to such an extent that if there are cases that are related to this, instead of taking those people abroad, they can actually bring them here and we will attend to them satisfactorily.
Well, this also is basically on respiratory support for our newborn babies, especially those who are born before time, as it's preterm babies. Because the idea is that respiratory problems of these babies are enormous, and it has contributed significantly to mortality amongst the newborns, especially those who are born before time. So the idea is that this training is meant to build capacity of doctors that work among these newborn babies to equip them on how to manage these babies better. And if we were able to achieve that, we would have drastically reduced mortality among this set of patients.
According to the team leader and head of hospital services, Obijackson Women and Children's Hospital, Dr. Ikechukwu Okonkwo, the two-day workshop is meant to reach out to the Southeast particularly to help in building capacity for the three levels of healthcare workers. They include the highly skilled like consultants, pediatricians, pediatric nurses, neonatal nurses, and those working in the neonatal units.
Now, the issue came with, should we do prophylactic or should we do what? Preventive. Should we do prophylactic or should we do rescue? That's the argument here. But you see, if you are on level 3 NICU, when you provide immediate room CPAP, immediate bedroom CPAP, and all of those things, you can begin to observe. But in our center where you have some challenges with CPAP or you are using COP, take this slide and apply it to what applies to where you are working. Now, prophylactic or preventive SRT is given at the time of birth. You don't wait for any signs, you just give the child that is born, it's less than 1,000 grams to give at home and provide CPAP. Now, rescue therapeutic surfactant, you have already done chest x-ray that confirm that the child is having what? RDS. Then you give surfactant. Are you understanding it?
Yes. Because of neonatal deaths happen in the first week. Like we normally say, we are so skeptical about the first hour of life. Okay, let's start with the golden minute, the first minute. We want to make this child breathe. We are so skeptical about the first hour. We are so skeptical about the first week, the first month. In respiratory care and in neonatal medicine as a whole, we are so concerned about this first, because we know that if things go wrong in the golden minute and it's not corrected, the risk of the baby coming out on the negative side is very high. So what is asphyxia itself? Asphyxia is inability to sustain, inability of the baby to breathe at birth, or when the baby takes the breath, the baby finds it difficult to sustain. So it's either this baby has failed to cry at birth or the baby has failed to sustain respiration.
And some of the medical conditions
predates the pregnancy. Some you see during pregnancy and even after pregnancy. Now, permit me to say, I've talked about high risk, being some pregnancies are at increased risk. But let it be clear to us that every pregnancy is at risk. You do not know when a pregnancy that has gone normal can suddenly become abnormal. A good example is fetal distress that just comes along the way while the woman has been doing well throughout her pregnancy. However, there are those that have increased risk. Obviously, you're seeing a risk factor, and you know that that risk factor is definitely going to affect the woman or the baby. And we need to do what? Pay extra attention to that pregnancy. That doesn't mean we don't pay attention to other pregnancies. But again, it helps us to know when to repair, when also to book the patient if it's for surgery, and even talk about normal delivery for that patient. Then it also helps us to do what? To involve other specialists. If I know of a high-risk pregnancy, before time I will talk to, like some patients that have gestational diabetes, I will involve the pediatricians. Some patients that have preterm level, definitely I will call them in to talk with the woman, the husband, because of the delivery. Because that's the point you now talk to them. They will tell you, you need, sometimes they come, they say, your baby is going to be born, you're going to be premature, the lungs are not mature, you need to buy surfactant. It's not after delivery you start talking to a woman about surfactant. That is not a good birth preparedness and planning.
The overall objective is to build their capacity in respiratory support and other related things. Some of the participants at the workshop speak on the new knowledge acquired during the two-day workshop. They also commended the founders of Obijackson Women and Children's Hospital, Okija.
So it's a privilege to get the opportunity to be retrained in a center close to yours. I'm from Delta State, and mechanical ventilation and generally respiratory support is something that is inherent in our practice and in my training in Del South, meaning every resident goes through it directly and indirectly. And I've had the privilege of attending other conferences about respiratory support group. So this is another opportunity to be retrained on it, because it's a center that believes in continuous medical training and examinations. So it's an opportunity that I launched myself into, and I'm happy I came to participate in it. It's been a worthwhile experience.
To build capacity such that wherever the facility is available for advanced resuscitation, I can be part of those that will add to the community by helping to use those facilities and improve neonatal care. So I think more of it should be organized, and then if they can extend to neonatal resuscitation care using the American Association of Pediatric guidelines to be a good thing. I think it's something that they should do, maybe quarterly. Yes, quarterly.
It's wonderful. It's well planned. We have learned a lot of things in this our workshop about respiratory managed care of the neonates. We have done a lot of good things about that. We learn how to use the ventilators and how to organize it. These are new things that are coming in. Some of us have it in our centers, but we don't know how to use it. So it's nice that we have come here to learn, have an idea of how to manage the things like the ventilators and CPAP and the rest.
A rate that you set on the machine, maybe you set it at 40. But when you look at the screen, you will see like 46, 47, meaning that the baby is contributing 7. 7 has been added to what you said the machine to deliver to the baby, meaning that baby is making efforts. From this place, you know that something is happening. Baby is responding. Baby is contributing. So at the end of the day, you will know when baby has fully taken over. At that point, you will see the respiratory rate getting doubled. Like you will be having something like 70 breaths per minute, whereas you said the machine to be delivering 40 breaths per minute.
Our first statement is critically ill child on ventilator, on setting, SIMV, ACPC, CPAP, skin, mottled. I don't know if you know what is mottled. Because some of us, we write things. Sclerema. You have problem, you have work to do. Sclerema. And then please don't use terms that only you can define. Use terms that are universally defined. Somebody will say cyanose, another person will say ashen. Then we would now know which one is correct. Describe in details. So we look at the vital signs, we look at incubator temperature, we look at trends. What are you seeing? If you're having necrotizing enterocolitis based on 1, 2, 3, 4, anemia and sepsis mean there is something is breaking down. IVH, you don't have to get a transcontinent to suspect an IVH.
The two-day workshop will help to boost the capacity of healthcare workers within the Southeast and Nigeria at large. It will also help to cut down on the high rate of neonatal mortality among children in Nigeria. According to the data provided by the WHO in 2021 and 2022, Nigeria is ranked third in neonatal mortality rate in the world. During the two-day workshop, the participants were engaged in various intensive practical training and presentations by a team of consultants from the Obijackson Women and Children Hospital, Okija.
What actually interested me about the theme of the workshop was actually the ventilation aspects, because it has been of interest for me to be able to know how to ventilate a baby and also make sure that baby is alive for the parents. It's actually a joy that when babies are born preterm, that the parents carry their baby back home. I've learned the best effective way to deliver CPAP, to know when it's not effective and when it's effective, when you're actually doing the right thing and doing it well. Then also how to ventilate a baby and how to operate a ventilator to make sure that you're actually doing it right for the baby, to save that baby's life.
So usually what we advise is you put the sick baby on temperature 1.
We don't normally do that. Even though they are twins, but
you guys
don't have when the whole incubator is used, but immediately one of the babies just even though
you have enough. There are places where
very fantastic. So these people, they are trying very much. So they coupled with the thing they taught us here, when I reach to my units, I will add it to my knowledge and improve the care of those babies.
In fact, this program will go a long way to improve the outcome of baby, children care and decrease mortality rate.
As a resident doctor in practicing in a resource poor setting like ours, we've learned a lot about the high-tech machines that are used in children and newborn in particular. We've not had hands-on experience of any, so it has been a theoretical experience all this while. So it has been my desire to have a practical experience of how these machines are used and how they operate. Kudos to the Obijackson team. They are really doing well, and they are actually shown that what is obtainable over there can actually be replicated here. And we look forward to having more of these facilities, because when we have many of them, we can actually close the gap existing in the public health facilities by coming to centers like this to upgrade our training.
We can get to measure the baby's stress and then know the task calibrations and know the exact. Now also, baby wears bonnet in order to get the tubes fitted on the baby's nostrils. Now this bonnet now has sizes, both for bigger babies and smaller babies. How do you know the size? You use tape measuring the tubes.
The participants were also taken round on a facility tour of the Obijackson Hospital which has a world-class state-of-art facilities, making it a center for medical tourism.
What I want to tell our people is that what they are looking for outside the country is here with us. They should come to Obijackson Women and Children Hospital. Anything that has to do with women, anything that has to do with children, both preterm and term babies that needs intensive care services, we have them available in Obijackson Women and Children Hospital.
We have standard equipment, we have the best of professionals in terms of doctors, consultants, and even our nurses and the support staff too. So that's a recognition of what we have achieved as a hospital.
Test of all vision you can have in life is the vision to serve mankind. And that is a man that has it in his heart to always give to the society. That's a laudable one. And he's not just giving in society, he's giving to mankind through hospital business. And that is the greatest of it. He's a philanthropist. Most of our patients here can't even pay. He's the one that usually will pay for them. So it's a good one, and others are encouraged to do so in their different villages, towns, and communities. By the time they start doing that, Nigeria will definitely be a better place, because of course government cannot do everything for us. Definitely, if you go abroad, you see there is this private-public partnership, and that is what we are encouraging, so that we can have a better society.
Obijackson and his wife, they are awesome. They have invested huge amount of money in this institution. Not only that, they employed qualified people. Everybody you see here is really qualified, both nurses and doctors and other medical staff. So they have invested so much, and they are making a difference in our state in this particular, because we are actually healing babies from far away. People come from Umahia, Owerri, Asaba, even Benin. We've had patients from Benin. So this hospital has done so much, and it's setting a standard. It's actually blazing the trail for others to learn on how to improve their care and save our people.
They have really done noble. They have given back to the people. They are not even counting what they are getting from the hospital, but they are still busy giving out, paying bills of the indigent people. You can imagine a baby that spends months in our neonatal intensive care unit with bill accumulated up to 2 million, 3 million. They will come and clear the bill. It is commendable.
Obijackson is a beautiful vision, and you can see that partners are now beginning to come together to bring up a major thing in the spotlight of the economy.
Like our slogan means giving back to the people, and we are trying our best to give back to the people in saving lives in the country.
We're also introduced to bubble CPAP, which of course we've been using in our center, the modified form, but getting to see what should be done and the proper way to doing things, to improving the outcomes of our patient was quite interesting. We also taught how to instill surfactant into premature children, especially those below 32 weeks and rather those below 28 weeks, and it's been quite interesting.
More than 50 medical practitioners on respiratory support services and other related matters across the Southeast and beyond benefited from the training workshop.
Well, we want to thank God for a very good outing. We want to thank Obijackson for providing us this space for this kind of possibility to happen here. We're really delighted to see. This is the first time we're holding this event in a facility. We used to hold it during conferences, but this one is in a facility using, so this is like another new phase of training. And we just want to thank all the participants that came from Owerri, Warri, Port Harcourt, and Asaba, Newi. We want to thank all of them and the wealth of information that has been deposited. And we look forward that this will make a significant improvement in neonatal care and reduction in neonatal mortality. Neonatal morbidity, neonatal mortality, reduction in mortality.
At the end of their training, They were all presented with certificates of participation to enable them provide respiratory support services to their various centers.